These are replicas of Roman surgical instruments, and they are based on the ones that were found at Pompeii at the house of the surgeon in 1770. Now I'll take you through some of what we've got here on the table. This is a speculum, and this would be used for looking into various orifices around the body. Now we have here a trephine, and this would be used for trepanning or trephination. And the way this works is that you would drill a hole in the skull, take out a piece of bone to relieve the pressure on the brain from a head trauma. There is another trephine here as well, which is called a half-moon trephine. We have a syringe here. Now this one is particularly interesting. It goes back to Greek times actually, and this had two uses. The first one for the removal of an infected uvula. That's the little thing that hangs down at the back of your throat. And if that got infected, it could swell your windpipe and you'd have a job breathing. So it's not a common operation these days. This would be inserted into the oral cavity, and then the uvula would be crushed first to stop it hemorrhaging, and then it would be snipped off and removed. A cautery iron like this would then be heated and then placed inside the mouth to cauterize the wound, to stop it from bleeding, in other words. A saw, a bone saw. Not for anything large like legs or arms, but we're talking about smaller digits, like toes, for instance, or fingers. Much better to amputate these things than to let infection spread.